The United States has a complex healthcare system that is currently in a state of change. The Affordable Care Act, ACA, was signed into law in March 2010 by President Barack Obama and came into effect in January 2015. The act provided insurance to 20 to 24 million Americans who previously had no health insurance. This act has come under a lot of criticism and is currently being reviewed with the intention of repealing it. The new U.S. Congress is planning on replacing the act with a new one. Healthcare is very expensive in the United States. Hospital stays for even a few days can cost much more than most Americans can afford. Still, there exists a complex network of clinics, offices, medical centers, hospitals, and outpatient facilities that are available to the public. Additionally, there are county hospitals and other low-cost facilities that can provide service to the insured and uninsured alike. Health maintenance organizations, HMOs, also provide medical services to the public. These HMOs are usually tied to employer insurance coverage, but individuals can purchase insurance from these types of healthcare providers too. Finding a good doctor, one that you feel comfortable with, is the first step in taking command of your healthcare. Once you find a good doctor, he or she can refer you to specialists who can address any special needs you may have. You can find a good doctor anywhere in the U.S., regardless of your insurance plans. All you need is a little patience and persistence. Most people in the U.S. do not rely on the Affordable Care Act for their healthcare needs. Many employers provide their workers with insurance as parts of the benefits package. However, other Americans purchase individual insurance plans that can be costly. Whenever a person is prescribed a medication, it is important for the person to read and understand the label that comes with the medication. Important information for dosage, frequency, and side effects of the drug is contained in these labels. Prescribed medicines are drugs that cannot be purchased without a prescription, which means only a doctor can give you access to them. The reason for this is because most prescription drugs are more potent than the so-called over-the-counter drugs. Prescribed drugs are usually focused on a specific ailment and come with side effects that can cause other issues to the patient. Labels on prescribed medicines also contain other vital information, such as the number of pills in the container, the date issued, the number of times you can reorder the prescription, the name of the drug, along with the name of the pharmacy that issued the drug. This information is important because of the nature of most prescription drugs and their side effects. Some side effects could impair the patient severely. The drug could make you nauseous or impair your vision. Some can also make you drowsy, which means the patient should not drive a car or operate machinery. It could be dangerous to the patient or to others that may be nearby. It is good to know exactly what prescribed medicines you are taking. If you are ever in need of emergency medical treatment, this information is important to the medical personnel treating you. Some drugs do not interact well with others. So if you know what drugs you are taking, emergency medical professionals will know what not to give you. So know your drugs by reading the labels. Cigarette smoking used to be very fashionable in the United States. It was considered a sophisticated habit that many of the nation's elite members engaged in, which was later copied by the general populace of the country. Younger people who smoked were the cool kids. Many young people who wanted to fit into the group started to smoke at an early age, only to discover that the habit caused quite a bit of harm to them. There was a time when cigarette advertisements were everywhere. It was legal to run commercial ads on television, radio, billboards, and bus benches, but all that changed sometime in the 1970s. Today, tobacco companies are limited in how and where they can advertise their deadly products. Generally speaking, smoking has fallen out of favor with most Americans because of the consequences associated with the habit. Cigarette smoking is the leading preventable cause of death in the U.S. today. Its effects on the human body are many and can be devastating. More than 480,000 Americans die from the negative effects of cigarette smoking each year. Cigarette smoking can lead to cancer, stroke, lung disease, and the overall health deterioration of the smoker. Smoking can make it more difficult for women to become pregnant. And smoking while pregnant not only affects the mother, it also has a negative effect on the unborn fetus. It can also lead to premature birth, low birth weight in newborns, and even stillborn babies. In men, cigarette smoking can reduce sperm count, making it more difficult to father a child. When a smoker smokes in public, he or she is also fouling the air and affecting those who do not smoke. It also makes people's clothes and breath smell. In all, it is a very bad habit. In order to maintain good health, there are a couple of steps to take to help you achieve that. One is to get your vaccinations, and the other is to get regular medical checkups. Vaccinations are preventative medical procedures that come in the form of an injection. Most children in the United States are required by law to be vaccinated for certain diseases that are easily transmitted from one person to another. Vaccinating children starts shortly after birth. The typical vaccinations include injections to prevent hepatitis A, hepatitis B, and polio. They stop the spread of measles, mumps, and chickenpox. These diseases were a big problem in the U.S. in the past, but they have all been eliminated through vaccinations. So if you are not certain if you have had your vaccinations, go see a medical professional. Getting a regular medical checkup is also important for maintaining good health. Doctors are highly trained individuals whose only concern is to ensure their patients' health. It is always easier to practice preventative medicine than to treat an illness once the patient has received it. Preventative medicine is best served by getting regular checkups. Most doctors want to see their patients every 3 to 6 months. By seeing their patients frequently, a doctor can determine slight changes in the overall health of their patients before they become a problem. Usually, a checkup will include taking blood and urine samples for analysis. Many illnesses can be revealed through these tests, and if caught early, are easily treatable. So make that appointment with your doctor. And if you do not have one, ask a friend, colleague, or family member for a referral. It could be the best thing you can do for living a long, healthy life. Eating a healthy diet can be confusing to some people, but it does not need to be. Healthy eating habits begin with you. The general rule is to eat as much plant-based food as you can, which includes vegetables, fruits, legumes, and whole grains. The foods to avoid are fatty foods and processed foods that contain a lot of empty calories and little nutritional value. Your health depends on the foods you put into your body, so think twice before consuming something that is unhealthful. Most nutritionists agree that vegetables are a key to living a long, healthy life. Nearly all vegetables are low in fat and calories and are a major source of a variety of nutrients. Many vegetables provide potassium, dietary fiber, and vitamins A and C. Vegetables are so low in calories that it is nearly impossible to gain weight by overeating them. Of course, this only applies to non-battered vegetables. It does not apply to deep-fried vegetables or vegetables that are used as part of a larger meal that may include cheese or other fatty components. Generally speaking, the most popular vegetables contain only about 50 calories per cup, and they are very filling. Eating lots of fruit can also be a low-calorie alternative to fatty foods that consist of red meat, such as hamburgers or sausages. Fruits contain natural sugar, which is healthier for the human body than processed sugar. Legumes and nuts are also healthy for the body, but contain more calories than fruits and vegetables, so be careful with how much you eat. The best thing to do is to educate yourself on the foods you eat. Knowing beforehand what you are putting into your body can help you make the correct food choices. Diet and exercise are two of the most important parts of leading a healthy life. There is an old saying in the United States that reads, "You are what you eat." It means that your overall health and appearance are greatly affected by what you eat. If you eat high-calorie, fatty foods, then you may suffer from obesity at one time or another. If, however, you eat plenty of green vegetables and little to no fat, your chances of being fit are much better. Many people are limited in the types of exercise they can do, but almost everyone can walk. A daily walk can help you achieve your healthy living goals. You should plan on walking at least 1 mile per day. A good pace to walk in is about 18 to 20 minutes per mile. Of course, The more you walk, the better. It takes most people less than 40 minutes to walk 2 miles, but the benefits of this could last a lifetime. Walking can reduce stress levels, increase stamina, lower blood sugar levels, and regulate blood pressure. Once you get started walking, you just may like it. Another benefit of eating right and exercising is that it can lead to a positive outlook in life. Practicing these good habits can make you feel and look better. Your clothes will fit a bit better, and you will sleep better, which will lead to a healthy self-image. A positive self-image can give you more confidence in whatever you do, whether it is at work, in school, or at home. So eat right, exercise daily, and enjoy the benefits. Regular dental visits can do more than keep your smile attractive. They can tell dentists a lot about your overall health, including whether or not you may be at risk for disease. New research suggests that the health of your mouth mirrors the condition of your body as a whole. For example, when your mouth is healthy, chances are your overall health is good too. On the other hand, if you have poor oral health, you may have other health problems, so it is important to see a dentist on a regular basis. Dentists are not hard to find. If you are working and have dental insurance coverage, your company will provide a list of dental care offices whose services are covered by their insurance. It would be wise to check this out. However, why is dental hygiene so important? Research shows that more than 90% of all systemic diseases, which involve many organs or the whole body, have oral health connections, including swollen gums, mouth ulcers, dry mouth, and excessive gum problems. Diseases such as diabetes, oral cancer, heart or kidney diseases, leukemia, and pancreatic cancer can all have ties to poor oral hygiene. Some of the things you can do starts with seeing a dentist on a regular basis. Seeing a dentist regularly helps to keep your mouth in top shape and allows your dentist to watch for developments that may point to other health issues. A dental exam can detect problems such as poor nutrition and improper jaw alignment. Provide your dentist with a complete medical history and inform him or her of any recent health developments, even if they seem unrelated to your oral health. One of the great advantages of oral health is having a great smile. A healthy smile can give a person confidence and is a good indication of a healthy body. Parenting is one of the difficult tasks people have to undertake if they have children. Parents are charged with raising children from birth until the child's 18th birthday. It is a challenging prospect these days for a variety of reasons. Each child is unique. So is the parent. In the best possible situation, a child or children will grow up in a two-parent household. This traditionally means with a father and a mother, although today it could just mean a two-adult household. In any event, research has shown that children are better adapted to adulthood when there is a two-parent presence in the household they grow up in. There are many theories on which style of parenting is best for children. Some may say that giving tough love is the best way to parent. Tough love is usually defined as letting your children learn about life through their own experiences, whether they are good experiences or not. Then there is the over-nurturing type of parenting. This is where the parents micromanage their children's activities and praise and encourage them regardless of their performances. Some would argue that this approach does not prepare children for the real world. Others argue that it is the job of the parent to protect their children. The debate can last indefinitely. Some of the pitfalls of parenthood are mistreating their children and committing child abuse. The definition of child abuse has changed greatly over the years. It used to be accepted behavior to hit a child when that child acted in an improper manner, but that is largely frowned upon today. The best thing to do is to do a little research. You can find a parenting group in your neighborhood and look for resources online. There is help out there. It is just a matter of finding it. Children depend on their parents for guidance, strength, and character. It is a parent's job to ensure that their children have a great chance to succeed in this world. That includes making sure their children are healthy. One of the things parents can do is to ensure that their children eat a healthy diet. Children should eat 3 healthy meals a day, plus a nutritious snack or 2. Another thing parents can do for their children is to make sure they drink plenty of water. Water is crucial to the health of a growing child, and it is good for adults too. Parents should also limit the amount of sugar and fat their children consume. Unhealthy foods include sugary sodas, juice, fried foods, and candy. These foods have little or no nutritional value and can cause your child to become dependent on sugary snacks for a quick boost. Sometimes the best thing you could tell your child is no. Breakfast is the most important meal of the day, so give your child a healthy breakfast every morning, which is vital to a child's well-being. It will allow your child to concentrate on his or her schoolwork better, and will fuel them until it is time for lunch. There is no better energy boost than a good breakfast to start your child's day. Practicing good hygienic habits are also good for your children. Teach them to brush their teeth, to wash their hands, and to bathe themselves at an early age. Of course, the best way to teach your child these habits, or anything else, is for you to act as a role model. If they see you practicing good habits, they will also do the same. Remember, a healthy child is a happy child.